Hi, this is Dr. Mayura, and I'm going to be going over some common questions about the symptoms of COVID, how to know if you have mild, moderate, or severe, when to go to the hospital. The AIIMS and ICMR released a new protocol to advise doctors on how to treat COVID. So I'm going to go over how to treat mild COVID at home and what to do. And also how to get a good pulse oximeter reading and what is a pulse oximeter, how accurate is it, which finger to put it on. So let's just go through those things. So to start, the symptoms are, I'm sure all of you are very, all of you have heard of these symptoms: fever, dry cough, headache, tiredness. So these are the main symptoms, even sore throat. The main symptoms you get. Then you can also get loss of smell and taste. Now you can also, in the new strain, get conjunctivitis, diarrhea, some gastrointestinal disturbances, and you can even get rashes present on the fingernails, or even rashes present on the skin. So these are all things to look out for. And you can also have a dry tongue, which is kind of a rare side effect, a dry tongue, because less saliva production. Now, if you are breathless and you have confusion, those are also symptoms of severe COVID, and chest pain and pressure on the chest. So those are symptoms where you have to talk to your physician immediately. Now, so let's go into what mild, moderate, and severe COVID is. Now, mild COVID is if you have upper respiratory tract infection with or without fever, but your respiratory rate is normal, and your normal respiratory rate should be between 12 to 18 breaths per minute, and your oxygen saturation is over 95. So that is, or 94, let's just say, that is your mild COVID. Then you can stay at home for home isolation. You can isolate at home. Now, moderate COVID is if your respiratory rate, if you're breathless, of course, if your respiratory rate is over 24 breaths per minute, and if your SpO2, which is your oxygen saturation, is between 90 and 93%. So then you have en room air. So that is moderate COVID, and there you should be hospitalized and you should get supplemental oxygen therapy. Now, severe COVID is if your respiratory rate is above 30 breaths per minute, if you're severely breathless, you're gasping, and you're having a lot of pain in the chest, and your SpO2 is less than 90% en room air. So then that is considered as severe COVID. So let's go over the people who are at high risk. So these individuals have to be very, very careful when they get COVID, whether it's mild, because it can easily transform from mild to moderate to severe in these individuals. So anyone over the age of 60 years old, anyone who's obese, anyone with any kind of chronic lung condition, has to be very careful. Anyone with chronic kidney or chronic liver disease, anyone with diabetes and high sugar, with hypertension, with any cardiovascular disease, be very, very careful. Anyone in any other immunocompromised state, young or old, and any cerebrovascular disease present. So all of these individuals have to be very, very careful. Also, now non-immunized individuals also have to be even more careful. No, non-vaccinated, sorry. And so now what do you do when you have mild COVID at home? So the first thing to do is isolation. Isolate from the rest of your family. You can use paper plates, cups, and paper items that you can dispose of without infecting anyone else. The second thing is you can wear your mask indoors as well. If you do come in contact with anybody, please wear your mask indoors. Strict hand hygiene. Keep washing your hands, sanitizing your hands, even when alone. Now, you have to stay very hydrated. So hydration is very important. So drink a lot of fluids and electrolyte if possible. Take your multivitamins. Zinc, vitamin C, and vitamin B12 have been shown to be effective and prescribed. Antipyretics. So these are like paracetamol and things to bring down fever. You can also take anti-cough medicines. You can take, they're called antitussives, and betadine gargle, which you can for sore throat and dry cough. Now, it's advisable to make a chart and chart out, even in mild cases, and chart out your oxygen, your SpO2, which is you use by the pulse oximeter, and to chart out your pulse, and to chart out your temperature. And you can do this at 8 a.m. in the morning, at 2 p.m. and at 8 p.m. So 3 times a day, and document it from the 1st to the 10th day. So this gives you, it's an organized way of knowing your progression of the disease, if you're, how you're doing, are you getting better, are you getting worse, and to just be aware and informed. about your condition, and you can also give it to your doctor. So all of this has to go through your doctor. So you should always be in contact with your attending physician when you have COVID, whether it's mild, moderate, or severe. So everything has to go through your physician. Now, in mild COVID cases, you can also, there are some low evidence based therapies that they're still trying, which is that they're using ivermectin, tablet ivermectin for 3 days, 200 milligrams. And they're using HCQS, which is hydroxychloroquine. They're using that as well, if not contraindicated. And they're also using an inhalational steroid, budesonide, which is used by a meter dose inhaler or dry powder inhaler. So that is usually used after 5 days of fever and cough with no remission, that budesonide inhalation. So those are the things that are being used now. Now, avoid oily or spicy food. You can do, you should do actually, steam inhalation and saltwater gargling, and drink hot teas with honey or ginger. So home remedies should be used in these situations. So now this is a treatment for mild. Now high risk individuals have to be very careful to measure their SpO2 and measure and their respiratory rate and the temperature and pulse. And they have to be aware because it can progress very easily. Now I want to just go through how to use an oxygen saturation probe, how to use a pulse oximeter. So now a lot of people are a little bit confused when I get a lot of questions about how to use a pulse oximeter. So a pulse oximeter is nothing but it's a clip or a clamp that you put on your finger, and it measures the level of oxygen in your blood. So now how does it do it? So it basically, it's a probe that you put on your finger, and the probe shines light into your tissue, into your blood, and your blood, its amount of light which is absorbed by the oxygenated hemoglobin in your blood. So that is the measure that's the readings that's coming out. And now this is always accurate. It's fairly accurate, but if you get a good pulse ox. Now, but the reading can be 2% here and there. So if your reading on the pulse ox is 82% of oxygen, then you can have it. So your real reading will probably be between 80 and 84. So that's how accurate. And now the best, you can put it on your, its pulse ox can be put on the earlobes, on the toes, on the fingers, but most often it's put on the fingers, and the most reliable finger is the middle finger. So when can a pulse oximeter reading be erroneous? It can be erroneous if you wear nail polish, especially blue and green in these colors, because it can obstruct the light reading. Any ambient light, any bright daylight, any light which is impairing the probe and it's going into the probe, that can also hamper the reading. If you have any movement also can hamper the reading. So be quite still when you're taking the reading. You have any hyperpigmentation or dyes on your fingers, like even mehendi on the fingertips can hamper the reading. Rashes, changes in the nail bed can all hamper the reading. And of course, there's some things that methemoglobinemia with hypotension and tricuspid regurgitation can also hamper the reading with some other conditions as well. So these are things you need to be aware of. So definitely don't have nail polish or mehendi or dyes on your hand. Make sure that you're not in bright daylight. Make sure you're not moving too much. And measure reading, and please make a chart. So I hope this helps, and please take care and please stay safe.